Hi there, my name is Dr. Jesse Scholes. I'm a physical therapist in Mukwonago, Wisconsin. Today I'm going to be showing you how to strengthen your back with 3 different concepts. The first concept is a top-down back strengthening exercise. Now, a top-down back strengthening exercise would potentially help you if you have back weakness that's preventing you from bending over to lift something up, even if you're lifting it with good body mechanics, i.e. lifting with your legs and not just rounding your back over to lift. The next exercise I'm going to show you is going to be for strengthening your back for more of a bottom-up function. So, for example, if you're going up the stairs, you put your right foot on the first stair, you press down with your leg to bring your left leg up to the second stair. That would be a bottom-up exercise, where your butt muscles and your back muscles are kind of working together from the bottom up. The last concept of exercise is going to be for the little stabilizing muscles, multifidi. Now, primarily these work for rotation, rotating your spine, or it might be a better put to not rotate or anti-rotation muscles. They stabilize you. They make sure your bones of your spine don't rotate. And this exercise, while maybe not the most obvious for why it might be beneficial, is a staple exercise of many different physical therapists. I'm going to show you a way that it works great for most of the patients that I do this with. Now, if you just had a back surgery, or if you have back pain that's chronic, or if you have new back pain, you might be a person that I would give these exercises to day 1 of therapy. However, sometimes you might have some sort of nerve that's being pinched, or muscle weakness, or something else that's going on that these exercises may not be right for you. So with that said, if you have any pain while doing these, I might not recommend them for you to do until you would consult with a physical therapist or a medical doctor to make sure that these are safe for you to do. Which generally, if your physical therapist tells you to do this stuff, they've already guaranteed or been as sure as they could be that these are safe for you to do, at least in concept. So, with that said, the top-down back strengthening exercise, all you will need for any of these exercises is a ball. The ball I'm sitting on right now, a physio ball or a Swiss ball, they're available a lot of different places. The best advice I could give you is that you don't want a super cheap one, and you don't want to waste a lot of money on one that you're basically paying for the brand name. And for these exercises, no matter how big your body is or how small your body is, I would say somewhere between a 55 centimeter ball and probably a 75 centimeter ball, you're going to be okay to do these exercises. So, with the top-down back strengthening, you're going to take your ball and you're going to get near a wall. You're going to basically press your feet into the wall for leverage. The closer the ball is to your thighs, the harder it's going to be. So because I've done this exercise before, I'm going to put the ball closer to my knees. I'm going to lean over the ball. I'm going to press my feet into the wall for leverage. Now, if you have your hands across your chest, that will be easier than if your hands are behind your head. Now, for this exercise, again, you grind or press your feet hard into the wall or door or whatever you feel comfortable putting your feet on in your home. You let yourself slouch over the ball. You keep your stomach tight as you lift yourself up. You hold for 2 breaths. You lower back down. You raise yourself back up. Hold for 2 breaths. 1 breath in, 1 breath out, not necessarily in that order. Down and up. I generally do not encourage patients of mine who do this exercise to go beyond the point of where your back is straight, where you're hyperextended. Some people do that with this exercise and have no problems. Other people do have problems, so I go from a position of slight flexion over the ball to being straight or just a little bit beyond that at the most. I would recommend doing this exercise every other day. 3 sets of 10 repetitions. And again, challenge yourself a little bit. Make sure that your form is good first with any of these exercises. But number 2, make sure that the 10th one that you do is a challenge. And again, the closer the ball is to your chin for this exercise, the easier it's going to be. The closer it is to your knees, the harder it's going to be. If you have a problem with balance, move your legs wider on the wall or the door, whatever you're bracing them against. You can have your knees a little bit bent or a little bit straight, whatever works better for you. Next, the bottom-up exercise. Again, the only piece of equipment you'll need for this is a ball, but I would say if you have a couch or something heavy with a frame that you can reach underneath with your fingertips, it works great. For this, I'm going to be using this barbell. So, the opposite rule is going to apply here for difficulty. The closer the ball is to your chin, the harder it's going to be. The closer it is to your waist, the easier it's going to be. Lying over the ball, hands underneath something for leverage. Tighten your stomach, lift your legs up, hold for 2 breaths, lower your legs down. Again, tighten your stomach to protect your back, lift both legs, hold for 2 seconds, lower them back down. Again, hold the stomach in tight, lift both legs, hold for 2 breaths or 2 seconds, lower back down. For this exercise, again, we do not want to hyperextend the back. We do not want to do this where you're arching yourself more backwards, whether your knees are straight or bent. If you cannot get your legs fully up, either A, you might need to bend your knees to decrease how long the lever is, i.e. how hard you're working. You might need to move the ball closer to your waist, or you might need to stretch out your hip flexors. But the main concept of this exercise is, again, pull your stomach in to protect your back, lift your legs up so hopefully your body's perfectly flat, parallel to the ground, and then hold for 2 breaths. Again, every other day, 3 sets of about 10. Challenge yourself. Move the ball closer to your chin if it's too easy. The last exercise. Now, the important thing about this is that I'm going to show you a progression. You need to make sure that your back is not rotating or shifting. Now, if you can't tell if your back is rotating or shifting, many times your pelvis will be the main kind of thing that you can use to notice what's happening inside your body. If you imagine a horizon in a plane, where the horizon can change right to left, that's what your pelvis will want to do. So, I'm going to show you, if you're doing this sloppily, what's going to happen in your pelvis with the best of that I can with the camera angle. So, if your pelvis is sloppy with this, if you lift up one leg, your pelvis will kind of drop on the other side. Now, that could be because of poor body control or because you're not strong enough to do this, which almost everybody, if you're lying over a ball on your stomach, you should be able to at least lift your leg. So, the apex or top of the ball should be underneath the mid portion of your stomach. Head looking straight down. Hands should be directly underneath your kind of neck. Lift up one leg, hold for 2 breaths, let it down. Lift up the other leg, hold for 2 breaths, let it down. Again, we want to try to make sure you're lifting your leg up so it is parallel to the floor. And what we're going to try to do is do 15 of these. If you can do 15 per leg of lifting your leg up, holding for 2 breaths, and letting it down on each leg. We always want to alternate legs with this. One on the right, one on the left, one on the right, one on the left. You are then ready to do level 2, which is lifting the opposite arm and leg. Now, key points. The closer your hands are, not shoulder width, but to the midline of your body, underneath your neck, the easier it's going to be to stabilize when you move your arms and legs. Number 2, when you're lifting up an arm and leg, your leg or arm may want to kick out to the side, which will not do you any good. You want to lift your leg straight up and your arm straight out in front of you as if you want to lengthen your body at the same time. As, again, we're keeping your low back and pelvis still. So, again, the apex or top of the ball underneath the mid portion of your stomach. Feet and hands fairly close together. Lifting up opposite arm and leg. Trying to lengthen your body. Hold for 2 breaths. And then on the other side, trying to lengthen your body, holding for 2 breaths. Alternating back and forth. And once you get to the 10th one, that should be good enough. If you do more than 10, you will absolutely improve the health of these muscles more. If you could do 20 of these per arm and per leg as you switch back and forth, you should probably find that you might get more benefit if you hold a small weight or use a small ankle weight. So if you put a 1 or 2 pound ankle weight on each leg around the ankles, hold a small weight or even a can of soup in each hand, this exercise becomes a lot more challenging. And as long as you make sure your pelvis and low back stay still, you should have no problems with this. So, these are your 3 exercises to do 3 days per week. I would recommend do them all on the same day. And before you know it, you should have a much healthier back. From the top down, the bottom up, and all those little muscles that are so important for people that have back pain. Thank you for watching. I hope this helped.